Smoking is one of the behaviors that causes some of our leading health outcomes, including cancer, but also cardiovascular health. And it is something that obviously we can do something about.
Quitting smoking is hugely important to overall wellness, and it's a big part of the conversation.
Based on the facts that we get from the CDC and how devastating tobacco use is in our area, I believe our tobacco use is anywhere between 21 to 22%. It's still relatively high, so we want to really focus on helping those folks live a more healthier lifestyle.
Behavioral health populations have a lot of challenges. Folks in this patient population smoke more than the average. It's a very powerful addiction that needs to be addressed because it does make up so much of the mortality and morbidity in this patient population.
One of the things I was blessed to do is the 2015 Community of Practice. The information was fantastic, learning how different communities throughout the country were assisting folks with mental illness in quitting tobacco use and how they approached it. And it really helped us take from that information how we can add that to our current programming here in the Pittsburgh, Pennsylvania area. And also the nice thing was it was the opportunity to network with the folks. People shared information if we wanted to call and get, how they were doing things. So it wasn't just a one-time deal.
I think key success is through community of practice. We're definitely the insight that we gained through working with all the other members, and especially the staff involved, and the insight they gave to us and encouragement as well. The webinars were a big help. Some of that we were already doing, but it's just that reinforcement of, yes, you're heading down the right path. I guess that's one area that we definitely continue to collaborate with anyone around the country and help them out. I think collaboration is the true key to success. You can't do it alone. Can't be afraid to ask for help.
Our work with Mercy on the COP and the collaboration has absolutely made my work in disseminating tobacco cessation information to the county at large easier. Pittsburgh Mercy has been a great partner in being able to talk to more people about how they can quit smoking and where they can get help for that.
When it comes to tobacco, we're very lucky to have a coalition that's already exists in Allegheny County, Tobacco Free Allegheny. So we turn to them, and I think that relationship is critical to actually being able to move the needle.
Our goal is to meet people where they are. As part of our community of practice, we started a Wellness Wednesday program where here at Pittsburgh Mercy, we purchased 10 new bicycles. And on Wednesday afternoons at our Southside campus, we reintroduced bike riding to a lot of our adults with mental illness and drug and alcohol issues. And it was amazing how they received it.
People could hike or they could bike. And this is where we got some of our first bicycles.
Working with groups to reduce their tobacco use is really critical, but also quite challenging. And I think the work that Pittsburgh Mercy has been doing with members of our community with behavioral health issues is really admirable. The ability to have partners like Pittsburgh Mercy makes such a difference because they can get out to the constituents, and moving policy forward takes a huge amount of effort, as you can imagine. So that has been, I think, something that we're particularly proud of. And again, there's no way we could have done this by ourselves.